Hi everyone. So for week five's post, I picked case study number one, and I'm going to just be reviewing that right now with you. So for the first question, which was what is the most likely diagnosis for JH based on the history and lab results? I picked post-cystic ovarian syndrome. Um, the quote that I'm going to use for that is this chronic and heterogeneous disorder manifests itself as menstrual dysfunction, infertility, hirsutism, acne, obesity. It describes a condition where at least one ovary or an ovarian volume greater than 10 mLs and at least one ovary has an estimated 10 small cysts with a diameter ranging from 2 to 9 millimeters develop. That's from Singh 2023. The reason why I chose that as my diagnosis is due to the patient's history of oligomenorrhea, for hyperandrogenism, the elevated LH and FS ratio, her obesity plus weight gain, and her metabolic abnormalities. The second question was what was the criteria for diagnosing this condition? Like I said, it was due to her amenorrhea, the no period for 5 months, the hyperandrogenism, acne, the dark, thick facial hair, her elevated LH and FSH, obesity, the metabolic abnormalities. According to the revised Rotterdam criteria, the diagnosis for PCOS is recommended if at least two of these conditions are met. One is a biochemical or clinical indicator of hyperandrogenism. Two is a sign of olgio or anovulation. Three is ultrasound findings showing polycystic appearing ovarian morphology, assuming that other related disorders have been ruled out. And that's Ghaffari 2025. What are the potential complications for this condition if left untreated? Um, PCOS is a reproductive disorder. It has long-term metabolic and cardiovascular effects. Metabolic would be type 2 diabetes, insulin resistance, and metabolic syndrome. Cardiovascular is hypertension, dyslipidemia, and an increased risk of heart disease. Um, Reproductive can be infertility and pregnancy complications such as gestational diabetes, endometrial hyperplasia, and increased risk for endometrial cancer. Psychological can be mood disorders, depression, anxiety, and those kind of things. The next question was, what are the treatment options for this condition? Combining lifestyle changes with medications for various ailments results in greater metabolic benefits and improvement in metabolic comorbidity parameters than monotherapies do. Additionally, treatment should also take into consideration increased levels of the AMH hormone, plasma metabolites, and gut microbiota composition, which are severe characteristics of PCOS, in addition to focusing on primary traits. And that's Singh 2023. Um, for these patients, lifestyle modification is important, weight loss, diet, and exercise, using combined oral contraception to regulate cycles. For the acne and the hirsutism, again, the birth control and the medications such as spirolactone and those kind of things. Metabolic management, they recommend metformin, which may help with weight. And for fertility, it'd be ovulation induction. The next question was, what are the patient's education points um, for JH regarding her condition and lifestyle modification? And of course, it would be weight and nutrition, talking about daily exercise, weight management, sustainable weight loss, eating a healthy diet, lean protein, uh, exercising at least 115 minutes a week with moderate activity, and metabolic risk awareness, understanding increased risk for diabetes and regular screening at primary cares, fertility counseling, if that's an issue. The management of PCOS necessitates a multifaceted approach including lifestyle modification, weight loss strategy, dietary adjustments, and pharmacological interventions. Lifestyle interventions such as exercise regimens, dietary modifications, behavioral strategies hold promise in enhancing metabolic health among PCOS patients. While no singular diet or exercise regimen emerges as superior, both Mediterranean diet, um, both the Mediterranean diet and keto diet have demonstrated favorable effects. Pharmacological interventions such as contraceptions, metformin, play pivotal roles in regulating menstrual cycle and mitigating symptoms. Personalized approaches that are tailored to individual responses are imperative for optimizing outcomes in PCOS management. And that's Gafari 2025. Thank you.